Hey, Dr. Lindsey here. This video is a little bit different than the usual. We had a guy yesterday that we did about 2,000 grafts on that had a cochlear implant. Now, for those of you who don't know about them, when people are either born deaf or become deaf, I mean completely deaf, their choices are sign language or something called a cochlear implant. And they came around about the time I started medical school. And essentially what happens is an ear, nose, and throat doctor called a neuro-otologist will drill out this bone here behind your ear and expose the cochlea, which looks like a little snail made out of bone. And there are three little compartments to that, and they take a little wire and stick up in the cochlea, and that stimulates different parts of the cochlear nerve. And then they sew the skin up, and then there's a thing on the outside that picks up sound and transmits it through the skin to this little wire. And they're not perfect, but they're certainly better than being deaf. And so the issue with this guy is that, first of all, we can't do anything to screw up the cochlear implant. Second is this whole part of his head has implant stuff going through it, and that's my donor area. So we're going to have a little bit smaller donor area than usual. And third is that we're probably going to need two cases to address this guy's problem. And he's got relatively low density but thick Middle Eastern hair that's pretty curly. So we'll do a case, or we did a case yesterday, and then we'll probably do another case in a year. So before we had it done, even though I'm an ear, nose, and throat doctor, I haven't thought about cochlear implants since I took my boards in '95. So I called one of my friends who puts these things in, and then I found the doctor that works on this fella, and had him go up, had the patient go up and see the doctor that put it in the day before, and he marked the area that I can't cut in with gentian violet, which is a semi-permanent ink. So that when the guy showed up the next morning, we were all set to go, and we numbed him up and did not use any cautery. The cautery is the thing that stops bleeding, because that could short out the cochlear implant. And show us a good bit of his case, and then he just came in for his first day cleaning. I'll show you what he looks like today, and as he comes in over the next week, I'll update this video. Interestingly, the guy's a pretty funny guy. He's a former bodybuilder, and you know, we were talking as I numbed him up, and then we lay him down to do the strip, and he takes off his implant, and he had prepared me, as I knew that he would be completely deaf. And so while I didn't think we'd injured anything, we put it back on. I was kind of expecting him to act like he couldn't hear, just to see how I would react, but he was a pretty cool guy. He did not do that. But this is the first one of these that we've done. I don't know how many people with cochlear implants have had a hair transplant, but if you are interested, this is how we do them. So this is a bit of an interesting case. This guy has a cochlear implant. As a chief resident, I helped put a few of these things in back in the 90s, but I'm not an otologist. So I sent him up to his otologist yesterday, who marked with this blue line for me not to go west of that. We'll take our strip over here and do a nice tricuspid closure and try to avoid the use of any cautery. We can use bipolar without shorting this thing out, but we're going to try to do it without anything. And close them up, and then we'll probably be back in a year to do a little bit more. We're probably not getting a couple hundred grafts because I can't come through here, but that's okay. We'll get plenty of hair for what we need from this side. Okay, so we get it mostly numbed up. We're going to the strip 2/3 on the right side, and then here's the line that the otologist said don't go past, and there's this device. Okay, so we just got the strip out, and although he's low density and we went a little wider than we generally would do, we stayed away from that implant, and we used no cautery, no battery cautery, no bipolar cautery, no nothing. I did a few sutures around some small blood vessels, but by and large it was the same as every other case we do. So we'll find out in just a second whether his implant works. So we just he just put back on his implant, and we put a wrap over top of it, and I told him that it didn't bleed any more or any less than any other guy that we do. And thank goodness he didn't just have to stress me out by acting like he couldn't hear when he put this thing on. But so now we'll deal with up here. So we got the hairs in. He's a little oozy, but not too much. Am I hurting you?
He's sleeping, Doctor.
Am I hurting?
No.
And you were saying that you were worried about getting this done after talking to your otologist, and it really wasn't bad at all. Didn't hurt.
Yeah, no.
So we got we're almost done with this case. This graft's went in pretty good, right?
Yes.
No difficulties with the cochlear implant, except as we made a few slits up here, and there's a little bit of blood that dripped back. We were uptight and put an extra wrap over top of his microphone. But no troubles. If we would have been able to go a little farther with his strip, we could have gotten another couple hundred grafts, but that's the essentially cost of having that cochlear implant there. Okay, so here's our guy that has the cochlear implant. This is the first day post-op. This is normal appearance. The first day, he said it was a pretty rough night as far as discomfort, but he said he's really not having any pain today, right?
Yeah.
And remember, we didn't use any cautery on him because we had to stay away from this cochlear implant. And that is exactly what it's supposed to look like.
Looks even better than
the average.
Than the average, yeah.
And we're just cleaning these stitches with a little bit of peroxide. We'll put a little Vaseline on them. And then, so today's day one. This is what we do. He can shower the back of his head and his body. We wait till tomorrow to start putting the water up here. And then on day 3, we start the shampoos. And my guess is that, like most guys, he's not going to be aggressive enough, so we'll have him come back on Monday and after he shampoos and conditions and see whether he's doing a good job or not. That way you got a few days to get it looking good before too many crusts build up. So Wendy's cleaned up the scar like we like to do it at home, and she's just putting a little Vaseline on it. And then some of you might say, well, how do you get all that Vaseline out of your head next week or out of your hair next week? And Dawn dishwasher, dish soap.
But by the end of the week, almost this is gone. Some people don't have anybody to put some Vaseline on them.
Yeah.
And that way it keeps, see, there's no scabies. It keeps the area moist, and it doesn't let any scabs to form. And that way it hurts less when you remove the sutures.
Yeah. Yeah, so this fella with the cochlear implant is day 6. And we've had some trouble with him cleaning, right? So he's come in every day. And yesterday he turned the corner. It looks really good. This is 6 days out.
Yeah, see, these are not stuck in his hair.
Right, and he hadn't pulled anything out.
Yeah.
And then his sutures.
They start right here. And he scars very nicely. Look at, you can't see it.
And that cochlear implant's still working. Good.
Yep.
So this is day 7 out. He did, after initially not doing such a great job cleaning, that is perfect. So now it is just a waiting game. And then the cochlear implant's still working. And we just took out his stitches, it's a little scabby back here. And we'll see how this goes and check him on in a month.